It is my honor, my pleasure, and my privilege to address all the members of SAR in Africa and impact interventions on comorbidities and emerging infections and non-communicable diseases. Many of you know that comorbidities like hypertension, diabetes are major risks for COVID. We also know that if you have these infections, managing HIV is a big problem. So this theme is very, very apt for the times that we are in as a result of the COVID epidemic. The second and very important theme is to build, strengthen, and invest in Africa's scientific capacity and manufacturing of vaccines, diagnostics, and therapeutics. We all know the problem of vaccinations or vaccines for COVID in this, particularly for Africa. We know from what is going on and the studies that are going on and the experiences we are having all over the world, that even though the vaccine is not preventative, it reduces morbidity and mortality. But here we are in Africa. Getting the vaccine has become a problem. We do know that this may not be the end of subsequent epidemics. Will Africa not come together to learn how to make vaccines for Africa? I think that's something that becomes imperative as we move on. And it's one of the major themes for our conference in Durban in 2021. The third thing is how to identify in Africa resource-tailored interventions for populations most affected, including women, children, adolescents, men, and key populations. This is very key for us because we know that the burden of HIV, the burden of malaria, the burden of TB, and to some extent, the burden of COVID is found in this population. So it's very, very important that we address the challenges that these populations face as a result of the number of diseases that I have mentioned. The fourth theme is to evaluate the impact of COVID-19 on HIV/AIDS response, share lessons learned in overcoming barriers in maintaining continuity of care of people living with and at risk of HIV infection. I had earlier mentioned the negative impact that COVID has on persons living with HIV. They have more severe disease. There's evidence that they die more. If we are going to succeed getting to the end of AIDS in 2030, this must be a very important component of management, of research, of policy, particularly that we do not know when this COVID epidemic will end. And then, last but not the least, to amplify national, regional, continental, and global integration to reach epidemic control in Africa. Contributions from Africans in the diaspora. As many of you may know, the membership of SAR stretches far beyond Africa. And we have many of our kinsmen and kinswomen in diaspora who have contributed to even making COVID vaccines. But here in Africa, we do not have these vaccines. Isn't it time that we invite our diaspora to work with us to improve our health system, to develop the vaccines of today and the vaccines of tomorrow, that we can get Africa that is free of HIV, Africa that can manage COVID, Africa that can manage comorbidities, and even COVID much better than we are doing at this moment. So I want to reaffirm to all our members and all the potential participants to Durban 2021 that we are confident that the conference will take place. We have been assured by the host country, and we are eagerly waiting to work with the host country and the International Steering Committee to ensure that Durban 2021 will be as exciting and a more successful conference than Kigali 2019. Having said all this, I'm excited to welcome all of you to Durban on the 6th of December 2021 for ICASA 2021.